The size of RBC in peripheral blood smear is accessed by comparing it with the size of option A neutrophil, option B small lymphocyte, option C eosinophil, option D large lymphocyte. And the answer is option B small lymphocyte. Heller and Pohl's mixture contains option A sodium fluoride and potassium oxalate in the ratio 1:3, ammonium oxalate and potassium oxalate in the ratio 3:2, potassium oxalate and sodium fluoride in the ratio 3:2, potassium oxalate and sodium fluoride in the ratio 1:3. And the answer is option B ammonium oxalate and potassium oxalate in the ratio 3:2. Fuchs-Rosenthal counting chamber is ideally used for counting of option A WBC, option B eosinophils, option C RBC, option D platelets. And the answer is option B eosinophils. WBC diluting fluid contain option A eosin, option B acetic acid, option C gentian violet, option D both, and the answer is option D both B and C. Ore roots are commonly seen in option A ALL, option B AML, option C CLL, option D CML, and the answer is option B AML. Platelet adhesion to endothelial cells occurs in the presence of option A von Willebrand's factor, option B anti-hemophilic factor, option C Heckman's factor, option D Christmas factor, and the answer is option A von Willebrand's factor. Drapkin's solution is used for option A WBC count, option B RBC count, option C HB estimation, option D platelet count, and the answer is option C HB estimation. Depth of Fuchs-Rosenthal counting chamber is option A 0.1 mm, option B 0.2 mm, option C 0.01 mm, option D 0.2 cm, and the answer is option B 0.2 mm. What is the time limit for doing prothrombin time determination after the collection of blood? Option A 2 hours, option B 4 hours, option C 6 hours, option D 8 hours, and the answer is option A 2 hours. Romansky stains are option A acidic stains, option B neutral stains, option C basic stain, option D none of the above, and the answer is option B neutral stains. HbF can be represented as option A alpha 2 beta 2, option B alpha 2 gamma 2, option C alpha 2 delta 2, option D alpha 2 epsilon 2, and the answer is option B alpha 2 beta 2. Which of the following Hb is most resistant to alkali denaturation? Option A HbF, option B HbC, option C HbA, option D HbD, and the answer is option A HbF. Which coagulation factor is necessary for the formulation of fibrin polymer from its monomer? Option A factor 8, option B factor 11, option C factor 13, option D factor 12, and the answer is option C factor 13. Normal level of plasma fibrinogen is option A 2 to 4 gram per liter, option B 100 to 200 milligram per dl, option C 0.5 gram per liter, option D 6 to 8 gram per deciliter, and the answer is option A 2 to 4 gram per liter. Which among the following is not related to DIC? Option A decreased fibrinogen level, option B decreased prothrombin time, option C prolonged prothrombin time, option D prolonged PTT, and the answer is option B decreased prothrombin time. Clot solubility test is used as a screening test for option A factor E, option B factor 9 deficiency, option C factor 13th deficiency, option D factor 8th deficiency, and the answer is option C factor 13th deficiency. The normal range of plasma factor 8th C level is option A 50 to 100 international unit per dl, option B 50 to 200 international unit per dl, Option C 10 to 50 international unit per dl. Option D 80 to 100 international unit per dl. And the answer is option B 50 to 200 international unit per dl. Schum's test is used to identify option A sulfahemoglobin, option B methemoglobin, option C oxyhemoglobin, option D methalbumin. And the answer is option D methalbumin. Donath-Landsteiner test is positive when blood sample shows hemolysis. Option A at 56 degrees Celsius. Option B after cooling at 4 degrees Celsius and rewarming to 37 degrees Celsius. Option C after cooling to 4 degrees Celsius and rewarming to 56 degrees Celsius. Option D after warming at 56 degrees Celsius and cooling to 4 degrees Celsius. And the answer is option B after cooling at 4 degrees Celsius and rewarming to 37 degrees Celsius. The G6PD test is useful in diagnosing hemolytic anemia due to option A malarial parasitic infection, option B antibody mediated hemolytic anemia, option C accident drugs, option D mycoplasmal infections, and the answer is option C accident drugs.